Times. Today's stories. COVID-19 updates from Edmonton. Teachers' unions challenge the Ontario Labour Relations Board. Michael Houghton wins the Nobel Medicine Prize for his work on hepatitis C. Educating Hima Magidoin on battling poverty in Nepal. Streets are empty in Tunis as a new curfew begins. The director of the U.S. National Institute of Allergy and Infectious Disease discussed reopening the economy. And in sports, the Seattle Storm win their fourth WNBA championship trophy. Hello everyone, you're watching Eagle News International from Canada. I'm Tiffany Elisassis reporting from Calgary, Alberta, bringing you stories from across the globe. Eagle News correspondent Thomas I. Likeness provides us with the latest COVID-19 updates in Edmonton. Thomas?
Smarten up, people. That's the message that public health officials should be giving to Canadians. We're at the beginning of a second wave of COVID-19 that hasn't even come close to cresting. That is, if the country's population keeps going the way it has been. The average daily case rate for the past week is more than 2,000. That's 2,000 new cases a day. A 40% increase from a week previous. 10 times what it was just a couple of months ago, back in July. What happened? I thought the curve had been flattened. My province is one of the big offenders, Alberta. An average of more than 250 cases a day being reported in Alberta. That's just the average. On Thursday, the province recorded its highest ever daily case count, higher than when the pandemic began, higher than any day since the pandemic began. 364 cases, and most of those new cases are in my city, the city of Edmonton. Those numbers have caught the attention of our Chief Medical Officer of Health, Dr. Dina Hinshaw.
As I mentioned on Friday, about 11% of active cases in Edmonton worked or attended social gatherings while symptomatic, which is concerning. Currently, about 36%, almost 2 out of 5 cases in Edmonton, were exposed by a close contact. Another 26% are linked to an outbreak.
As I mentioned, my city has more than half the active cases right now, and Hinshaw tells us many of them are community transmission, and those could have been easily prevented.
Where transmission is known, household or community contacts appear to be a key driver in spreading the virus throughout the city. Social gatherings and family gatherings continue to be a factor in virus-spreading events. We have also seen several workplace outbreaks where spread between employees has occurred, showcasing an opportunity to improve prevention measures within workplaces.
So again, in plain language, smarten up, people. Hinshaw has announced 3 new measures to try to control this virus, but these measures are voluntary. You see, there's no appetite among provincial lawmakers to make them mandatory. The economy was struggling before the pandemic. COVID-19 has only made it worse, and Premier Jason Kenney says he doesn't want to increase the economic suffering by bringing in new restrictions. So what are these voluntary measures? The government is asking people to limit family and private gatherings to no more than 15 people, as few as possible. It also wants masks to be worn in all indoor workplaces, offices, manufacturing facilities, whatever, wherever it's not going to be dangerous. And people should limit the number of cohorts they are in to no more than 3. Now, this is a holiday weekend in Canada. It's Thanksgiving. And Hinshaw says we have to break with tradition this year.
I especially caution Albertans against planning large get-togethers this weekend. Now is not the time to be gathering in large groups, traveling long distances for the holiday, or sharing food or utensils with people outside your cohort. Keep your Thanksgiving small, keep it safe, and protect one another.
Which brings me back to my opening statement. Smarten up, people. You see, the population as a whole has to take responsibility for controlling the spread of this infection. Going to work or socializing when you have minor symptoms, well, that's just not acceptable anymore. Despite what some people say, this virus is not like a minor case of the flu. It's deadly, and it spreads like a California wildfire. In the meantime, I wish you all good health. Remember to take care of others and take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times.
Thanks, Thomas. In Ontario, 4 major teacher unions challenged the Guide to Reopening of Ontario Schools by the Ontario Labour Relations Board. Eagle News correspondent April Masungsung with the details.
Last week, the Ontario Labour Relations Board has dismissed a challenge by 4 of Ontario's major teachers' unions. The unions challenged the Ontario government's Guide to Reopening Ontario Schools, which they claim violates the province's own safety measures recommended to stem the curve of COVID-19. Now that the second wave of the pandemic is running through the province, gatherings in Ontario are back to 10 people maximum within an indoor setting and no more than 25 in an outdoor setting. However, this does not apply to schools. For this reason, Ontario's 4 major teachers' unions held a press conference Wednesday to express their disappointment over this decision. According to ETFO President Sam Hammond, this is happening because Premier Ford and Education Minister Stephen Lecce gave so little time and insufficient funding for school boards to plan the return to school. Between June and September, the Education Ministry gave 3 different directions to school boards and downloaded the responsibility to them with only 3 weeks left before the start of school. Issues like large class sizes, a rapid uptake in distance learning, and new tech platforms for students learning at home are stretching the capacity of both parents and educators to ensure students get the education they need. The union's challenge was backed by medical experts. In his comments, Dr. David Fisman, epidemiologist at the Dalla Lana School of Public Health at the University of Toronto and consultant in infectious diseases at the University Health Network, said, "We all want to see back to school succeed in Ontario. That's why masking and reduced class sizes are so important for the protection of child health, the health of teachers and staff, and the health of our wider communities." Tension between the provincial government and teachers' unions has been prevalent since the early summer, when many perceived the Ford government failed to provide an adequate and timely school reopening plan that would ensure proper safety measures were put in place, while the province insisted that their plan was approved by the chief medical officer. As of Wednesday, October 7th, 379 schools have reported 722 COVID-19 cases. 402 of these cases are students, 117 are staff members, and 203 are other individuals. So far, 2 schools have been closed because of COVID outbreak. In Toronto, April Masong, Eagle News. We live in interesting times.
University of Alberta virologist Michael Houghton, who won the Nobel Medicine Prize alongside Harvey Alter and Charles Rice for the discovery of the hepatitis C virus. Harvey Alter and Charles Rice, together with Michael Houghton, won the Nobel Medicine Prize for the discovery of the hepatitis C virus, paving the way for a cure. The 3 were honored for their decisive contribution to the fight against blood-borne hepatitis, a major global health problem that causes sclerosis and liver cancer in people around the world. The jury said the World Health Organization estimates there are around 70 million hepatitis C infections globally, causing around 400,000 deaths each year. It is characterized by poor appetite, vomiting, fatigue, and jaundice. Thanks to the trio's discoveries, highly sensitive blood tests for the virus are now available, and these have essentially eliminated post-transfusion hepatitis in many parts of the world, greatly improving global health, the Nobel Committee said. Their discoveries allowed the rapid development of antiviral drugs directed at hepatitis C. Prior to the trio's work, the discovery of the hepatitis A and B viruses had been a critical step forward. The discovery of hepatitis B won the Nobel Medicine Prize in 1976, but the majority of blood-borne hepatitis cases remained unexplained. The discovery of hepatitis C virus revealed the cause of the remaining cases of chronic hepatitis and made possible blood tests, the new medicines that have saved millions of lives, the Nobel Committee said. Alter was credited for his pioneering work in the 1970s, studying the occurrence of hepatitis in patients who had received blood transfusions, determining that their illness was neither hepatitis A or B. Houghton built on Alter's work to isolate the genetic sequence of the new virus. Rice, 68, subsequently completed the puzzle by using genetic engineering to prove that it was a new strain alone, hepatitis C, that was causing patients to get sick. Rice, who worked at Rockefeller University in New York, called the trio's building block discoveries a successful story for biomedical science. Maggie Doyne was a gap-year teenager who turned into a philanthropist on a mission. Gipoli Valley's children's home in the West, Nepal's Sikrit, founded by Doyne in 2008, now shelters 54 children. Her school is attended by 450 students who would otherwise have a little chance at getting an education.
Community, that the way to make change is through education. It's the only way. And empowering children, educating children is the only way to truly end cycles of poverty and violence, which we were seeing in Nepal. Where would you want your child to go to school? You would do anything to give your child the best education. And so just because these kids don't have an advocate and they're victims of poverty doesn't mean that they deserve anything less.
With the COVID-19 pandemic, Doyne and her team coordinated the relief effort for thousands of Nepali migrant workers stranded without food or shelter as they returned home from India.
And there were thousands and thousands of people, tens of thousands coming across the border at this point, and there hadn't been enough pre-planning to work on those logistics. So it became an emergency, life-threatening situation very, very quickly. And, there were hotel owners that were cooking overnight and delivering meals, and every business owner would show up and drop off chow chow or biscuits, and the water factory would call from Nepalganj and donate water. And then there was a student-led youth groups and Rotaracts, and within a matter of really 5 days. So it showed the power of the collective individual, I guess.
The streets of Tunis are empty, and police patrol after authorities decided to reestablish a curfew in Greater Tunis for 15 days to try to limit the outbreak of new COVID-19 cases. For 15 days, traffic will be prohibited from 9 p.m. to 5 a.m. during the week, and from 7 p.m. to 7 a.m. on the weekends. This decision was taken following an increase in the number of virus cases over the past week. Tunisian authorities have warned that hospitals are struggling to cope with an influx of COVID-19 patients and urged residents to respect antivirus measures to avoid another lockdown. Dr. Hikami Lazur, spokesman of the Scientific Committee for the Fight Against COVID-19, said 345 COVID-19 patients were hospitalized and 120 of them required oxygen support as of October 1st. Tunisia, which had virtually contained the pandemic at the end of June, recording some thousand cases and 50 deaths, lifted most of the restrictions over the summer. But the number of confirmed cases has now reached 20,000, including nearly 300 deaths. Coming up, Director of the U.S. National Institute of Allergy and Infectious Disease discussed reopening the economy. And in sports, Seattle Storm won fourth WNBA championship trophy. Eagle News International continues after this.
Mga kababayan, Naharap na naman po tayo sa mabigat na pagsubok na ito. Ito yung COVID-19.
I hope everyone's okay. I hope everyone's safe.
Nandito po kami para hikayatin pa po kayo na maging matibay.
Mas maging matatag po tayo and just stay positive po sa lahat po ng nangyayari ngayon.
Mga mahal kong kababayan, lampasan po natin, pagtagumpayan po natin ang pagsubok na ito.
Stay strong sa panahon po na to.
Huwag tayong mawawalan ng pag-asa.
At inihikayat din po namin kayo na sana makinig po tayo sa ating gobyerno.
Sumunod muna tayo sa gobyerno dahil yun yung pinakamainam na paraan para hindi na lumagana pa yung virus.
Let's all stay at home.
Spend time with our loved ones, with our families. At higit po sa lahat, make sure to pray for everyone, pray for everything that is going on right now, especially our frontliners po who are sacrificing their lives to take care of everything.
Higit sa lahat, patuloy tayong lumapit, magtiwala at manalangin sa ating Panginoong Diyos.
Lagi tayong manalangin dahil yung po ang may pinaka-mainam na solusyon sa lahat po ng mga problema natin.
God bless you and your family. Please stay strong and keep our faith.
Tuloy po ang laban.
It says the best defense is still containment.
We are in uncharted territory.
Final volume 450. Apply on to 100%. Traffic man. Constructioning.
Welcome back. You are watching Eagle News International from Canada. I'm Tiffany Elisasis from Calgary, Alberta. Dr. Anthony Fauci, the director of the U.S. National Institute of Allergy and Infectious Disease, recently participated in an online interview hosted by Hawaii's Lieutenant Governor Josh Green. They discussed a wide range of topics from reopening the economy to addressing challenges that are unique to the Aloha State. Eagle News correspondent Milo Arsenis from our Hawaii Bureau has more.
Earlier today, Dr. Anthony Fauci repeated some updated guidance on just how deadly the coronavirus can still be, even when the necessary precautions are already being taken.
When you say aerosol, that means that these respiratory particles, they don't immediately go to the ground. They have the capability of floating around anywhere from many seconds to minutes, or maybe even longer, which means that being just 6 feet away isn't necessarily the total protection. You've got to wear a mask, number one, and you've got to remember that if you're indoors, it is much more difficult to escape infection when there's aerosol spread because it continues to recirculate. If I'm in this room and there's no really good circulation in and out, you can have that droplet that go around for several minutes. So just being 6 feet apart is not going to help you. And there's been demonstrations of people in restaurants who are sitting way distance from somebody on the other end of the restaurant. One person is infected, and then you wind up, this person who never came near that person winds up getting infected, which tells you, underscores the two things that I've been telling you. One, wear a mask. Number two, outdoors always better than indoors. And if you're going to be indoors, keep the windows open.
Dr. Fauci also shared some troubling statistics on those that may be infected with COVID-19, but are not experiencing symptoms.
It is estimated that between 40 and 45% of the people who are infected do not have symptoms. That is a substantial proportion, particularly when you do the modeling. You can estimate that, again, a substantial proportion of the infections that occur are from an asymptomatic infected person to an uninfected person. So if that large a percentage is asymptomatic, you have a big problem in identifying when you have community spread about who is spreading the infection around.
The 79-year-old Brooklyn native even acknowledged Hawaii's challenges in enforcing safety measures, especially social distancing and going on quarantine if infected.
I could almost feel how frustrating that must be, because you're not going to change the way people have lived for forever, a traditional way that families and communities live. So the best thing that you can do is to try and prevent the community spread to get high enough that would make those, multi-generational 20 plus members in a single household, you don't want to just throw them out of the house. I mean, they've got to live the way they're going to live. So you really want to try as best you can to keep the infection away. It's almost like protecting the vulnerable. And I would imagine that there would be a substantial proportion of the people in that multi-generational home that are in the elderly class and are having underlying comorbidities. I mean, it almost has to be by statistics alone, because you're going to have grandma and grandpa and maybe even great-grandma and great-grandpa in that home.
The two doctors also talked about Hawaii's plans to allow pre-travel testing, as well as balancing priorities in enforcing safety precautions while also reopening the economy.
So a 14-day quarantine in a location that depends on tourism is a real tough one, because most people have 2 weeks of vacation. They don't want to spend it locked up in a hotel, no matter how beautiful the hotel is. So what I would do is I would do something, but it doesn't necessarily mean 14 days. In other words, I can understand the anxiety of people on the island saying, if you just do a test 72 hours earlier and that's all you do, that's not going to be enough. I mean, you're just anxious. But again, you don't want to go and quarantine everybody. That would hurt the tourism business. But you mentioned 2 or 3 things that are worthwhile. You can either get the really cheap, rapid, not that sensitive test and test everybody that comes through quickly, bango, and not like a really expensive, total amplification PCR. You're not going to get everybody, but statistically, you're going to dramatically diminish the likelihood that an infected person enters. Or you can do what you suggested, surveillance. Don't test everybody, but pick out representative ones to see what's coming into the country, and special attention to people that might have been at greater risk, like college students coming back from hot areas.
Finally, Dr. Fauci shared the latest in the government's efforts in developing a vaccine against the virus.
The United States government has made major investments in 6 vaccine candidates, 5 of which are already in advanced phase 3 trial. We have a safe and effective vaccine by November or December. The reality is, no matter what you do, there are going to be infected people who slip through the cracks. It's inevitable. It's going to happen. The critical issue is that since you have such a low level of infection right now, that you should be able to handle that and prevent that from blipping up. I mean, you've got to be able to prevent that from happening.
Reporting from Honolulu, Hawaii, I'm Mila Sanas for Eagle News. We live in interesting times.
The Seattle Storm won their 4th WNBA championship trophy to tie the Houston Comets and the Minnesota Lynx with the most titles in the league history. Eagle News correspondent Tini Sumagi from New York files this report.
The Seattle Storm swept past the Las Vegas Aces to take their 2nd WNBA title in 3 years. The Storm, who also won in 2004 and 2010, have now tied the Houston Comets and the Minnesota Lynx for the most championship titles in league history. Breanna Stewart won her second Finals MVP of her career, and the veteran Sue Bird, who is part of all of Seattle's 4 championship titles, remains optimistic to return for her 20th season next year.
To be able to be here, to get through all that we've gone through as a team, obviously individually, it's an amazing feeling. And, you know, there's so much of an unknown that you don't know after, you know, rupturing my Achilles. But I'm, you know, super, I don't know if I'm proud of myself, but, you know, proud of you know, what I've done. I think it's hard to kind of see it, you know, because it was so close, but really hard to, really proud of, you know, just being able to be back and be able to be where I am.
I don't even know, now I'm ranting, but I think the point is the fact that I'm sitting here, I think I'm having this like in shock moment because it doesn't really feel real that we just won and that I was able to contribute in the way that I did. But it is 100% something that when it's all said and done, I will be incredibly proud of. That from 2002 to 2020, I was able to win 4 times with the same franchise. You know, interestingly enough, it's never like this day of decision, you know. I think I just kind of start working out and I see how I feel. I wish I could give you more, and I'm not trying to be elusive. Like, listen, if the way I feel right now, if I can go through my off season and continue to build on that in a good way, I don't see why I won't be playing next summer. So I'm not trying to be like elusive, but as I've always said, like things happen. That's what the last 2 years have taught me. You know, anything can happen. So I'm just like, you know, cautiously optimistic, I guess.
Congratulations to the Seattle Storm, the queens of the wobble. In New York, Tenny Sumagi, Eagle News, we live in interesting times.
That's our program for today. Join us again next week as we bring stories that matter to you. Visit our website at eaglenews.net and eaglenewslive.com. Follow us on Twitter at twitter.com/eaglenews and on Facebook at facebook.com/eaglenews. Thank you for watching. I am Tiffany Elisasis. We live in interesting times.